Hi, my name is Abhijit Sidhu, and today we'll be discussing the topic of bilious emesis in neonates by this mnemonic. We'll be covering the topics of mnemoperitonium, free air that is, Hirschsprung's disease, meconium ileus, duodenal atresia, and malrotation. So this mnemonic may look very complicated, but it's pretty easy and funny as well. So before we get on to the mnemonic, we want to, if you're faced with a patient with bilious emesis, a neonate with bilious emesis, we want to stop all the feeds, do a NG tube decompression, and give IV fluids. After that, we want to find out what the reason of bilious emesis is. So this is where this mnemonic comes into place. As you can see, there are two kids standing on the middle of the crossroad. They're named Billy and Emma, depicting bilious emesis. Billy and Emma have gone for trick and treat. It's Halloween, and they've decided to basically go to people's houses and see if they get tricks or see if they get treats. Okay, so the first house they go to is called the air house. It's called the air house because there's a large fan on the top of the house depicting free air or pnemoperitonium. And they knock on the door, and this surgeon comes out, and he scares the hell out of these kids because there's blood coming out of the surgeon's mouth. So that depicts that there's bloody emesis, there's shock because the kids got scared, and there's surgery required. So after they get scared from the air house, they go to the second house, which is the loophole house. So this is a very weird place as well. Now remember that we didn't get any treat from there, so they're going to try their luck here, but they are not very lucky. So they get inside the house. Loophole house represents dilated loops of a bowel. Billy and Emma, they get inside the house, and they are greeted with two large loops. They think they're slides, but they are mistaken because these two big loops are vacuums instead. A nightmare for the kid. So they get sucked up into these tubes. These tubes are one in white in color and the other is black, depicting that we need a contrast enema because it gets sucked and the direction is upwards. So this is to remember that it is a contrast enema and it is not swallow. So it's a contrast enema, and this is the second house they visit. So this complication is after 2 days. So we'll come back to that. So the first loop that you see is dilated at the beginning, but then it gets narrow. And one of the kids who went inside had a very tough time coming out of the tube. He did come out of the tube, but he fell into a pile of meconium. So after he fell into the pile of meconium, he wasn't very happy with himself. So this depicts that meconium ileus has microcolon. The second is second tube gets stopped in the midway, and this has a sign which says stop. This is a transition zone, and after that the kid basically falls into the spring, depicting that this is Hirschsprung's disease. Hirschsprung's disease has rectosigmoid transition zone. This happens at the second day, depicting as this was the second house. So two things in the second house, and this happens after the second day. So they move on to the third house. The third house is the bubble house. So as you can see, there are two bubble making instruments on the top of the house. They're making two bubbles, which is the double bubble sign. Double bubble sign seen on the X-ray for duodenal atresia. Du means two, and duodenal atresia has a double bubble sign. So we still didn't get any treat. If we do an X-ray and we don't get any of these three, like mnemoperitonium, dilated loops of bowel, and double bubble sign, our last bet is to do a upper GI series. Now this house is very interesting as well. It is on stilts, it has stairs, and it is on the upper floor. After we did an X-ray and we found a gasless abdomen, we'll do a upper GI series. The upper GI series is depicted by the house being on the upper floor, and the stairs, which are called series in Hindi. In the upper GI series, if we find that the ligament of Treats is on the right side of the abdomen, that can lead to malrotation. So ligament of Treats, if it's on the right side of the abdomen, depicting by Treats, the candy that is on the house depicts that the ligament of Treats is on the right side of the abdomen, which can cause malrotation. Malrotation is shown by the stilts, which are kind of weird and malrotated. Just to summarize, this was the mnemonic for bilious emesis, Billy and Emma. After we do the preliminaries of stopping the feeds, NG tubes decompression, and IV fluids, we want to do an X-ray. The first house was the air house, mnemoperitonium. The surgery was required. The kids were shocked, and there was bloody emesis. The second house was dilated loops of bowel. We want to do a contrast enema to see if there was meconium ileus depicted by microcolon, or Hirschsprung's disease depicted by a transition, rectosigmoid transition zone. The third was double bubble sign in duodenal atresia. And the last one, if there is no air in the abdomen, we want to do an upper GI series depicted by the upper floor and the stairs. And the stilts are malrotated, and probably there is a malrotation because of ligament of Treats on the right side of the abdomen.